Hey guys, my name is Rosa. I'm currently a registered nurse in Canada. Today I'm gonna share with you guys about some questions that I have received from the other international students or internationally educated nurses who are interested in studying in nursing school or who would like to start their career as a nurse in Canada. For those of you guys who haven't known me yet, in my channel I'm gonna share with you guys about my nursing life or my tips on how to study while in nursing school, how to find a job, part-time job when you just arrived in Canada, or how to get a full-time job as a nurse. And I also share with you guys about my daily life. Don't forget to subscribe to my channel, hit the bell to get notifications about my new videos. Let's get started. The first question that I received is, should I work when I am studying in nursing school? With me, I actually got a part-time job when I was in school. With me, I think that if you can arrange your time, it's gonna be better if you have a part-time job. For example, you can work as a personal support worker, or you can work as a caregiver who can go into the patient's house to provide care for the clients, or you can work as a sitter or patient observer in hospitals. So when I was in my second year in nursing school, I applied for the job as a patient observer in the hospital that I am actually working now. So I think that is a great opportunity for you guys as a nursing student to have the hands-on experience in providing care for the patients, so you will know how people work, or you can build your communication skills. You can work with different people from different teams like doctor, the nurses, social worker, physiotherapist, or OT as well. And moreover, when you are working in that hospitals or the long-term care as a nursing student, and then when you graduated from the school, you can apply for the job as a nurse in that facility because you already had the experience working in that facility. So I think that's, if you can arrange your time, if you can balance your life, your studying, your work, I think you should work during your nursing school. And the second question that I got is, what are the difficulties when I was studying in nursing school? So to be honest, there are a lot of difficulties when I was a nursing student because I was an immigrant from different countries. So the first thing gonna be like the different cultures. When you provide care for the patient, you need to understand the culture. You need to be like sensitive to the culture so that you can understand what is the appropriate way to approach your patient, how you provide care properly. And I think the communication is another challenge because you are a nurse and you need to communicate not only with your patients but also with the other people from different healthcare teams, and you need to have a good communication skills so that you can work well as a team member. And the other thing that most of the nursing students found, it is really challenging when studying in nursing school, that is how you can pass all the exams, especially for some majors like anatomy, physiology, or med-surg. It's really hard because you need to learn a lot of medical terms. For some courses, you are not allowed to fail 2 times. I mean, like, you will have one chance to fail and then you need to pass that, otherwise you gonna be failed from nursing school. It's really tough. What is the salary of the nurses? To be honest, you can search the salary, like the average salary for registered nurse or registered practical nurse. Google, when you search, it will have the average salary for you guys. I don't know how about your schedule, but for me, I will work like 3 or 4 shifts per week, and I will have the other like 3 or 4 days off for each week. So usually if you have time, if you don't have a kid, you can work at the different places. Like my friends, they are working two jobs, one full-time job in the hospital and the other will be like with the clinic or with the agency. They can get a higher rate. You can make like a good amount of money if you can arrange your time and you can work like two jobs, because you will have a lot of days off. The other question is, if you have another degree and then now you would like to study nursing, so is it possible? So the answer is yes, it is. There are different programs like second entry at York University that I know so far, and the other program at the Nibissing School. So for those of you guys who already have a degree, if you would like to study in nursing school to become a nurse, you can study this program. It's only 2 years, and then after that you can become a registered nurse as well. If you are an internationally educated nurse and you would like to become a nurse in Canada, so what is the pathway for you guys? I know that there are a lot of nurses from different countries like Philippines and from India. They actually got their degree, their education evaluated, and then they took the exam to become a nurse in Canada. So I have met some of those when I am at work, and I know that first of all you need to have your education to be evaluated by NNAS. It is the National Nursing Assessment Service. And then after that, when you get the result from the NNAS, if you are compatible, it means your studying, your practice is like compatible with the degree in Canada, so that you are allowed to write the NCLEX. And then after you pass the NCLEX, you will follow the other steps to become a nurse in Canada. But basically, like, you already passed the standard. And then if in the case that you are incompatible, it means like you didn't pass the evaluation process, you will have two options that I know so far. You will be allowed to take the other exam. It's called Internationally Educated Nurses Competency Assessment Program. In this exam, you're gonna have two parts, written parts, and the other is the objective structure clinical examinations. For the written part, it's going to be the multiple choice exam, including up to 97 questions, around 2.5 hours. And the other part is going to be like the clinical examination. It consisting of 12 stations, and it will take around like 13 minutes each. And then after you pass the exam, you will be allowed to take the NCLEX and then follow the similar steps. And in the other case, that if you didn't pass that exam, and then you need to study the other bridging program, so that you can meet the gaps that they found when they did the evaluation on your degree, your education, or your nursing practice in your home country. And as a nurse, do you need to stay in one home unit when you are at work, or you can float to different floors, different units? For those of you guys who haven't known yet, actually you can become a floating nurse. Like me, I am working with a nursing resource team. It means that I will work in different floors, especially in the med surg floors. So you will work in different units. You will expose to different disease, different populations, and you will meet a lot of new friends, new coworkers. For some of you, like, who really want to explore to different things, to get more experience in the first couple of years when you're just graduating from your school, so you can become the floating nurse, so that you can learn more things. And then when you find out the unit that you really love to work in there for a long period of time, and then you can settle down in that unit. But becoming a floating nurse, I mean, like, working in different floors, is it like really lonely? Do you feel lonely sometimes when you are not belong to that floor? But actually I didn't feel that way. I feel like I know a lot of friends, all the people are very supportive. They are all my friends. They always help me, and this is great. I don't feel like bored whenever I come to my workplace. If you have any questions, don't forget to leave a comment below, and then I will answer it as soon as I can. And don't forget to subscribe to my channel, and see you in my next video. Bye.